Welcome back to Learn with MedNuggets. In this video, let's find out what happened to Stacy and how to treat her. Stacy is 57 years old. She felt a tightening chest pain in the retrosternal area that began all of a sudden while she was giving a lecture to her students. She felt the pain radiate to her shoulder and lower jaw. It was a severe pain and she had it for more than 20 minutes. Absolutely nothing relieved her pain. She tried sitting down and resting for a few minutes, but it still didn't go away. She started feeling nauseous and began to sweat. So what happened to Stacy? Stacy experienced an ischemic type of pain. She also has hypertension, dyslipidemia, and she smokes around 1 pack of cigarettes per day. Her father had a heart attack at the age of 58 years. So Stacy has risk factors for acute coronary syndrome. Now the question is Stacy having acute coronary syndrome? What is acute coronary syndrome? Acute coronary syndrome results from acute obstruction of a coronary artery. The most common cause of acute coronary syndrome is an acute thrombus in an atherosclerotic artery. This can happen due to rupture of an existing atherosclerotic plaque which exposes thrombogenic material in the plaque. This activates platelets and the coagulation cascade to produce a clot. The clot blocks the blood vessel and cuts off the blood supply to the region of the heart supplied by that blood vessel. Depending on the degree of blockage, we can classify acute coronary syndrome into 3 types, called unstable angina, non-ST elevation MI, and ST elevation MI. Each of these types are managed differently. Is Stacy having acute coronary syndrome? If so, which type of acute coronary syndrome is she having? Let's find out. After taking a quick history and physical from Stacy, perform a 12-lead ECG. But remember, your history and physical exam should not delay you from taking the ECG. Until you get the results of the ECG, give Stacy drugs to relieve her pain and prevent the propagation of her blood clot if any is present. You can remember these drugs with the mnemonic Mona doesn't tolerate bullshit, which stands for morphine, oxygen, nitrates, aspirin, beta blocker, and statin. By the time you finish giving Stacy these drugs, her ECG results will be here. If the ECG shows ST elevations, Stacy has a ST elevation MI. If the ECG has ST depressions, inverted T waves, or pathological Q waves, Stacy has a non-ST elevation MI or unstable angina. If the patient has a ST elevation MI and she came to the hospital within 12 hours of onset of chest pain, you can treat her with reperfusion therapy. There are 2 types of reperfusion therapy called PCI and fibrinolysis. PCI refers to the insertion of a balloon catheter to a blocked atherosclerotic artery to open it up and restore blood flow to the myocardium. Fibrinolysis or breakdown of the fibrin clot can be done with tissue plasminogen activators such as altiplase and retiplase, as plasminogen activators cleave plasminogen into plasmin, which degrades the fibrin core of the thrombus and dissolves the blood clot. PCI can be given if the door-to-balloon time is less than 90 minutes. If it is more than 90 minutes, give the patient altiplase or retiplase provided the patient has no contraindications. Absolute contraindications to TPA include a history of intracranial hemorrhage, ischemic stroke within the last 3 months, presence of cerebrovascular malformation or intracranial malignancy, active bleeding except menstruation or bleeding diathesis, and significant closed head or facial trauma within the last 3 months. If the patient had the chest pain for more than 12 hours, do not give reperfusion therapy to these patients as it can lead to ischemic reperfusion injury in these patients, as the damaged myocardium can release oxygen-free radicals following reperfusion, which can further damage the already injured myocardium. So you can manage these patients with continued medical therapy. If the patient's ECG findings are consistent with a non-ST elevation MI or unstable angina, you can distinguish these two types by the troponin level. If Stacy's troponin is high, she's having a non-ST elevation MI. If it's normal, it's an unstable angina. Why is the troponin normal in unstable angina? Because the ischemia is not severe enough to cause infarction or death of myocardial tissue. Troponin is an enzyme inside myocardial cells. It's only when these cells die that troponin is released to the blood. If Stacy is having a non-ST elevation MI, put Stacy on dual antiplatelet therapy. Means in this situation, add another antiplatelet drug on top of the aspirin she's already on. And give the patient an anticoagulant like low molecular weight heparin, such as enoxaparin. If Stacy is having an unstable angina, assess the severity of her condition using the TIMI or Gray score. If the risk is high, perform an angiography within 24 hours and put her on antiplatelet drugs and anticoagulants such as low molecular weight heparin. Based on the angiography findings, you can treat the patient with PCI or CABG. CABG is generally done if the patient has a significant block in the left main coronary artery or in the case of triple vessel disease. If the TIMI or Gray score reveals a low risk, do a non-invasive stress test. If the test shows abnormal results, then do a coronary angiogram and treat the patient based on the angiography findings. This brings us to the end of our video. Here's the ECG strip of Stacy and her troponin level. Let us know in the comments below what type of acute coronary syndrome she's having and how to treat her. Thank you for listening. Have a great day.